Okay. So first of all, I'd like to introduce the presentation right now. It's actually advanced in pharmaceutical care and scope of community pharmacy. There's a lot of change happened because of COVID, what happened during the COVID during the last 2 years. So the main thing is the scope of practice for pharmacists for the community pharmacy. This is according to the health network system in Canada here. So all of us know about the traditional pharmacist scope, which is preparing a prescription and dispensing a prescription and the counseling. And in Canada here, everything is reimbursed by the government. For example, for the dispensing fee for each item in the prescription is ranged from $4 to $14 per drug. This means if the prescription, for example, there is a prescription for 5 medication, so here the dispensing fee or the counseling fee will be $20 to $60 according to the pharmacy. And there is a markup and there is a cost of the medication. Since COVID started, actually before COVID, as all of you know, that the College of Pharmacy is the most important organizing the whole scope of the pharmacist in Canada here. So we have a College of Pharmacy in Alberta, College of Pharmacy, and for example here in Ontario, which is responsible for the main scope of the pharmacist. So since COVID started, all the scope started to change from the regular scope to a different kind of scope. So the new scope right now, it's about 6 scope added to the function of the community pharmacist. Number 1 is called medication review, which is usually done in the community pharmacy or in a home or in a long-term care. The second scope is pharmaceutical opinion program. The third scope is initiation and adapt and renew a prescription. The fourth one is vaccine and injection administration. Vaccine and injection administration, actually before it's only for flu shot and other vaccines. But because of COVID right now, the pharmacists can also give the COVID vaccine. And also just 3 weeks ago, the pharmacist right now can do the test immediately in the pharmacy. And within 1 month from now, the pharmacist can give the medication immediately without referring, which is a new tablet, which will be available in Canada here after 1 month from now. The pharmacist can do the test immediately in the pharmacy, and if the patient is positive, immediately he can give him the medication according to initiate or adapt or a prescription for the patient. The fifth one, which is very important, it's harm reduction program here, fifth and sixth, and number 7, sorry, it's an harm reduction program. Number 1 for smoking cessation program. Number 2, and this is very important actually, because here in Canada, as you know, the mental health and addiction is the number usually increased, especially after marijuana become legalized. المروانة هي في بلادنا اللي هي الحشيش يعني اسمحوا لي اتكلم بالعربي في دي. المروانة هو عبارة عن الحشيش في بلادنا او اللي بيتدخن عموما. والحكومة الكندية الفيدرال جوفرمنت عملت ليجاليزيشن لتدخين المروانة. بقى دلوقتي اي حد بيدخن مروانة it's legal, there is no problem. At the same time, they implement the harm reduction program for methadone and Suboxone and naloxone. And also the harm reduction program for sexual transmitted disease, HIV and hepatitis C. So what about the medication review in the community pharmacy? Medication review in the community pharmacy is one-to-one interview between the pharmacist and the patient in a special area in the pharmacy. So for example ممكن برضك اتكلم بالعربي هنا. لو عندي انا صيدليه مثلا ممكن اقول اسماء زي صيدليه النهدي، لازم يكون فيها private counseling area بحيث البيشنت هنا يقدر يجي يقعد مع الصيدلي ويتكلم معاه، بحيث the pharmacist can review all his prescription medication and non-prescription medication. And this is very important because this encourages the patient to better understanding of their medication and getting the most benefit from their medication. The legalization here in Ontario, for example, because this is also this type of counseling or this type of service is paid by the government. And next slide, we'll see how the government pay for this. So the patient must have minimum 3 prescription medication for chronic condition. We can say that the patient must have a medication for example, a diabetic patient, hypertensive patient, and a patient with depression. This is a 3 chronic medication. So the patient is right now eligible to do the medication review. Also, the patient discharged from the hospital, immediately he is liable to the medication review. Or there is any change in the medication. For example, if the patient is taking warfarin, or the patient taking a new antibiotic, or if there is any patient non-compliance, like the patient is coming to the pharmacist and said for him, when I take this medication, for example, I had some gastric upset or I had any side effect, the patient here must do a medication review. And also if the patient planned to go to the hospital. The new thing just added also, if there is any referral from the physician or a nurse practitioner. Right now, the rule also of nurse practitioner in Canada during COVID increased, the scope is increased. Right now, the nurse practitioner can prescribe a medication, can refer a patient. So the rule for nurse is increased during the COVID right now, and the scope also for the nurse is increased. So for the medication review, as we said, it's a private area in the pharmacy. It takes from 20 to 30 minutes, and this is claimed to the government according to the health network, because all the system is reported directly to the health network system. So for each patient, he need to do medication review annually, and the pharmacist takes $60 for this, and he need to make follow-up 4 times per year, and the cost is for each one is $25. All of this is reimbursed by the government, the Ontario government, as we can see, Ontario Drug Benefit. And the same thing for the rule of community pharmacists for the home health care and home respiratory care and home infusion care. This is a new during COVID also, because we can see that if any patient need infusion at home, the pharmacist can visit him with the team. And this is a new thing, which is the pharmacist must one of the, we can say, expert team for home health care and long-term care. We can see the nurse, the respiratory therapist, medical social worker, dietitian, and the pharmacist also is one of this expert team to do the same service. The same thing, why this kind of service is available, or this kind of scope? Because this is for the patient who cannot attend to the community pharmacy. For example, if we have senior old age, he cannot walk to the pharmacy, he needs his prescription. So at this time, the pharmacist, the community pharmacist, can send a pharmacist to him at home and do the same thing, which is the medication review at home. So at this time also, we can see the same requirement. It's minimum of 3 prescription medication for chronic condition. And also here is we can see the empowerment from the government is high because the first visit is $150, and for each assessment it will be $50. You can see the PIN number. This is the pharmacist use it to bill it to the government. Also, the MediCheck program in long-term care, it's the same as what we say about home visit to do a medication review. But because here we have a lot of long-term care home residency, I don't know if this type of service is available in Saudi Arabia or not. So the pharmacist can go and do the same in the long-term care. And here you can see the payment also is $90, and each visit, and after this, the review will be $50. The second thing which is new, which is a pharmaceutical opinion program. Pharmaceutical opinion program is a new program also during COVID. This one is related to the potential side drug-related problem. If there is any problem happen at the time of conducting a MediCheck. So this program is related to the medication review. When you're doing a medication review and the pharmacist find any kind of side effect, he need immediately to report this and take an action immediately to save the patient at this time. So the importance of this program is to improve and optimize the drug therapy, ensure the benefit for the patient, reduce the inappropriate medication used, and drug waste. So at this time, if the pharmacist have three options, actually, either to stop the medication, or as we said here, not fill a prescription, or change the medication, or change the prescription therapy immediately. And after this, he can claim it to the government. This is a very important part. So the first part is doing a medication review, and if any drug-related problem during the medication review, the pharmacist can either continue, the patient can continue the medication or discontinue the medication, or the pharmacist can change the medication. Also, during COVID, there is a new scope, which is adapt and initiate and renew the prescription. Right now, because of COVID, before usually the patient can dispense a prescription only for 30 days. Right now, because of the COVID, actually the pharmacist can dispense a prescription for 60 days, 90 days, and sometimes for 1 year for chronic patient like diabetes and hypertension and depression. So he can renew the prescription for 1 year and just fax the doctor about the condition of the patient. And we will go through how the pharmacist can do this. Initiate a prescription. This is the pharmacist right now can initiate a prescription for the patient. If the patient cannot see the doctor immediately, and adapt a prescription also. So this program actually is follow the same rules, which is a standard practice and operated is a code of ethics, and it is mainly help to either to initiate a prescription. For example, when we are talking about smoking cessation, the pharmacist can initiate a prescription for propofol. Adapt a prescription. It means that the pharmacist can change the dose or the dosage form or regimen or route of administration for the medication. Renewing a prescription, right now the pharmacist can dispense a prescription for 12 months. So the step for this is very important because first one, the pharmacist must assess the patient, assess the history, the laboratory test for him, symptoms, and the red flags, and other medication taking, pregnancy and lactation, and any other circumstances for the patient. After assess the patient, this happen all of this in the community pharmacy. Second thing is the pharmacist must take a consent. This is very important from the patient that he will start to renew or adapt or give him a new prescription. The consent is very important because of liability. If the pharmacist did this function without a consent, he can lose the license immediately. And the third thing, prepare the prescription. It's like immediately, it's like the doctor prescription, the patient name, the address, the strength of the medication, the date of the prescription, every thing related to a prescription as the doctor did in his prescription. And the first thing here is documentation. Documentation, because right now the pharmacist and nurse and all the healthcare team is working as one team. Immediately, the pharmacist must fax or update his doctor about the new prescription issued by him. And also, if the pharmacist require lab test or anything, he must update the doctor. Because as you know, here in Canada, there's a family doctor which is responsible for the patient, and which is usually, as we can see, it's a GP. And then we have the family doctor is responsible to transfer or refer the patient either to a specialist or to any kind of service in the healthcare system. The new practice also, it's new and old, because here vaccine and injection. So before, the pharmacist can give a flu shot. Right now, the pharmacist can do a test for COVID and give a flu and give a COVID vaccine. And there's other vaccine also, like pneumonia and other type of vaccine, and like shingle and pneumonia, and other type of injection like vitamin B12. So this is mainly this is a universal influenza and immunization program, which is usually every year the pharmacist gives we can say a flu shot, what we call it here flu shot, and also this is billed to the government. And for each shot, the pharmacist get not the pharmacist actually, but the pharmacy, which is like if we are talking about Rexall or Walmart, or the organization itself take $5 for this. And for COVID right now, but the pharmacist gets $13 for each shot for COVID right now. Actually, this kind of service help a lot to give a huge amount of vaccination to the Canadian here, because all the people, they can take the vaccine either in the pharmacy or a doctor or the nurse can give the vaccine. So a huge amount of vaccination given in a very short time during the COVID. So we can say around 50% of the Canadian people whom, as you know, because of the human rights and all of this, 50% of the people whom agree to take the vaccines, they took it within around 2 months. 50% of the Canadian vaccinated within 2 months. The fifth program, which is the starting of harm reduction program, is the smoking cessation. And this is very important program also during the COVID and before COVID also, and it's covered as the same by Ontario. It's Ontario, it's because I'm living in Ontario actually, in Ottawa, so I'm related to Ontario, so everything is approved by Ontario College of Pharmacy. It's an Ontario drug benefit. Actually, it's the same thing like what we call it, either we renew a prescription or adapt a prescription or issuing a prescription. The pharmacist must follow the same instruction, which is the 5 A's algorithm: ask, advise, assist, and assist, and arrange. And also, he's looking for the assessment and consultation meeting, which is around 20 minutes in the pharmacy, and then follow-up session, and then start to give him the prescription. The primary follow-up usually session is taken 3 weeks, and the second one is after 4 to 7. And as you can see here, also, it's reimbursed by government. For the first one, it's $40, and for the second one, it's $15, and for the third one, it's almost $10 for secondary follow-up for the patient. So this program is usually continue for 1 year and also can extend it to 4 or 5 years to just maintain the what we can call that maintain that the patient did not smoke during this time. Continue with the harm reduction, which is mainly is related to, as I said before, since the marijuana legalized by the government, right now we have an opioid agonist therapy against marijuana, and right now the pharmacist can dispense either a methadone, which is mainly opioid antagonist in the pharmacy, and also at the same time the pharmacist can give Suboxone, which is mainly as a tablet. So for example, when the patient start, he will start with methadone, and methadone dispensed in the pharmacy as a syrup mixed with orange juice or apple juice. And after 1 year of using the methadone, he can switch to the naloxone, can switch actually to what we call naloxone propionate. Here, the pharmacist cannot issue a prescription for this medication. This only by the doctor, and this is very important. The only one can prescribe either a methadone or Suboxone is the doctor. The pharmacist cannot do it according to issuing a new prescription. So at this part, the pharmacist follow only the instruction from the doctor. And we have also, this is very important, which is naloxone kit, which is mainly using while the patient is overdose. And you can see here it's a kit, either we are talking about injection or nasal. So is that if the patient immediately or anyone coming to pharmacy and saying that there is a one overdoses in the street or in front of the pharmacy, or right now the Canadian is eligible to come to the pharmacy before going to smoke marijuana and ask the pharmacist, I'll go to the party tonight, so I need to take naloxone with me just for any emergency. The pharmacist dispenses naloxone immediately for him and give him the instruction to use it, especially the intranasal one, and send the this is with his health card, and immediately send the invoice or bill it to the government. So with the all new scope for the community pharmacy in Canada right now, the most important part is better pain control. The most outcome for the patient is better pain control, lowered hospitalization rate, and fewer emergency room, reduction in schedule of medication, and decrease the depression score. And this is very important here, because during COVID, the visit to the emergency room is too high, and most of hospital mainly I can't say refuse, but it's mainly used for the COVID patient during this time. So most of the Canadian during this time, I can say most of Ontarian people, they had a lot of depression, and the depression score increased when the new scope implemented and the community pharmacists start to do this. The depression score completely went down during this time. So this is the main new practice for community pharmacy, which is right now become like, we can say it's a small clinic in the street right now, helping the patient during COVID. And as I said, they try right now to increase the scope. Right now they try to increase the scope. The medical advisor in Canada for the Prime Minister and for the healthcare system. They tried right now to increase the scope for the nurse and registered nurse mainly, and also try to increase the scope for the pharmacist. The most important, I sorry to forget to say that the most important, the pharmacist cannot do any part of their job without license. For example, if the pharmacist need to dispense methadone, he need a license. If the pharmacist need to do a smoking cessation, he need a license. The license here is education, then training, then exam, then approved by Ontario College of Pharmacy or approved by any province college, like for example, as I said before, British Columbia College of Pharmacy, Ontario College of Pharmacy, and the pharmacist cannot implement or start to do any type of a new scope without getting the license for this new scope. So this is the end of my presentation, and thank you very much, and I'm ready for any question.